All right. So we can now begin since she has joined. Okay, so once again, thank you everyone for being here. You're all highly appreciated. So this is the second session for the 2-day webinar on certified nursing assistant. And once again, the whole idea is to be able to have informed knowledge concerning what it entails, what the expectations are, what the opportunities are, and what sort of strategy you should have moving forward. I know some of you, of course, even from the last session, you have some experience while some of you are new to this field. So it's an opportunity for you to actually listen to those who are already practicing and be able to listen to what sort of strategies or what sort of things you should know and you should do or not do to be able to move forward in your career ambitions. All right, so let's not waste too much time. We've already spent 10 minutes. I will release the floor to our director so that she can continue with today's session. It's going to be from 7 to 8 p.m. and it's recorded as well. So for I do hope that for those of you who were not able to make yesterday's session, you were able to watch it, and hopefully you also get to listen to this and have all your questions answered as well. All right. So once again, thank you so very much for being here. You're all highly appreciated. So, madam, the floor is yours.
Oh, thank you, Mr. Akorede. How are you? Okay, I think
All right.
quick one here. Yesterday, because of time, let us quickly where we ended yesterday about the healthcare team members. The healthcare team member will quickly brief on that and their responsibilities. So when we are talking about the healthcare team members, we're talking about the registered nurses, which is the RN nurses, then the licensed practical nurses, which is LPN nurses, or the vocational nurse, which is LVN nurse. Please take note of that. So you know the difference between these nurses and all that. So the work of an RM nurse, when we talk about the responsibilities of an RM nurse, we talk about the nurses. They are the ones who perform the assessment, develop care plan for these nursing assistants or any assistant healthcare, just like the auxiliary nurse here in Nigeria. Then provide nursing care directly and dedicate certain tasks to other nurses team. So then the other nurses team members and supervises other members of the nursing team. That is the RM nurse we are talking about now, which seems to like be the senior nurse and all that. Then when we talk about the LPN nurse and the LVN nurse, well, they help with plans to deliver and supervise some types of nursing care too under the direction of the registered nurse. You can see the difference now. So then the certified nursing assistant, which are the one we are talking about now, or the home health aid nurse, which is the WHA, they provide basic nursing care under the supervision of the RM nurse or the LPN nurse or LVN nurse. So, and the doctor, we all know the doctor determines the person's illness or the condition and supervises the medical care, write the medical orders and prescribes the medications for your patients for treatment and all that. Then the advanced practical nurses, those ones, or the clinical nurses specialists, those ones are practice independently or along with the doctor to diagnose treatment and manage medical conditions. Okay, so then we'll talk about the discharge plan. That was the last chain we were talking about yesterday. The discharge planners, the continued care nurses, like cases of management or utilization manager. They work with other members of the healthcare teams too to develop plans and for meetings and the person's care, the needs of the persons there, leaving the hospitals or the setting and all that, assisting with other making necessary arrangements for the patient to be discharged or leave the premises if the patient is getting better and all that. Activities and directors of recreational therapies too. Those ones, they plan and coordinate activities that provides opportunities for socialization spiritual support to creativities and entertainment, exercises and community and civil involvement. For example, like voting and all that, those ones are activities directors and recreational therapies. That is what they do, okay? Spiritual supports and all that. That is to tell you that when it comes to spiritualism, is important in healthcare section. So as we are working on what the things we are being taught, we also place God first. Whatever thing you hold strong, if you're a Buddhist, whatever, you are from Krishna, whatever, Oboni society, wherever you are, you know, that you believe so strong, you support with it, you know, while you're doing your treatment and all that. Then the physical therapies, the occupational therapies, you know, those will also help with speech therapies, okay? For those people who can't really speak well, swallow, the dietitians who help to plan for food for patients and all that. Social workers too, all those social workers, okay, then the psychologists too, all those people, the pharmacists, those pharmacists help too to help to the medication that the doctor has prescribed to give to the patient and all that. And then the religious leaders, also the religious leaders, for example, the priests, the ministers, and the rabbis, those people too, they also help. And they're all part of the healthcare team members. While we're doing our own, the one we study, they will be the one interceding for us spiritually, those spiritual support. So that because some sickness is not just physical, some of them are spiritually, spiritual issues. So the healthcare organization made us understand that these people, all these pastors, that we need, those ones who are true men of God, not those people who use the name of God for money, or those who go to source power in different places and all that. So we should also recognize. Hello? Hello?
Hi.
Yeah, so
we
we
can
should
hear
also
you.
recognize these people in the healthcare sector. Okay, even the environmental service employee. Are you guys hearing? Okay. So even the people in this environmental service employment
Yes,
too.
we can.
So they are all healthcare team members. So when we're talking about healthcare team members, not just the people who work in your facilities, so this set of people I have mentioned, they are healthcare team members, okay? So a quick one, let us talk about, before we go, let us talk about professionalism. When we talk about professionalism, we'll be able to understand how professionalism came into the system of healthcare, and for you to differentiate the local healthcare worker and the international healthcare worker, you know. So when we talk about professionalism, we talk about competency, those people who are, you should be good in whatever thing you're doing, your skill as healthcare worker, you should be good, you study well in the class and all that, be competent with the job you're doing. Don't do half-baked job. Don't do high service job. When you're doing, as a healthcare member, as a professional healthcare member, international healthcare member, you shouldn't look at anybody. You shouldn't look at your supervisor. Whether your supervisor is there or not, you should be able to do a quality job, okay? Then another thing, you have to be reliable. People have to rely on you. If people do not depend on you, you're not a professional. You can't work internationally, okay? Especially in your teamwork and all that. Don't be late. Don't be late. Do you understand? In your shift, don't be late. No excuses. You should develop time for your work and all that, you know, for your work and whatever thing you're doing, you should develop time for it. You know, you develop time for it. Don't give excuses. They are not welcome when it comes to professionalism. Then when we talk about professionalism again, we talk about, you know, being optimistic. It goes a very long way. As a professional, a healthcare professional, it goes a very long way. Honesty, integrity, then respect for one another, then supporting one another. That you know this particular task does, and your colleague doesn't know it well, you shouldn't disgrace the person publicly or in public of the patient that you guys are working, because it looks like you guys are doing quackery. So, but you can use ideas, use language, body languages to discuss with one another concerning these mistakes and all that. Professionals do not disgrace one another. Do you understand? Okay. So, and also learning how to listen carefully. When you listen carefully to one another, solve problems, support one another, you know, you stay focused at workplace. Staying focused at workplace, you know, all this helps you. Then some people might just get jealous that you're being too professional and all that. But the truth of the matter, when you build yourself as a professional in healthcare section, it goes a long way for you. People will look for you, okay? Then another thing we'll have to also consider as a professional and a satisfied nursing assistant is see medical abbreviations. Medical abbreviations, they are very, very important. You see, those terms, for example, when you're talking about maybe somebody like lawyers now, they all have their languages. Some groups of lawyers, if they're sitting here and they are talking, you might not understand. They can sell you off. The same thing applicable with the healthcare sector. When you are able to study your what do they call it? Abbreviation, medical abbreviation. You study it very well. I tell you, even when they use these abbreviations, you will be able to learn. And when you're doing your remark on a patient, you'll be able to use those abbreviations. And when your RM nurses sees it, checking your remark on your this thing, they understand what you're doing. They now know that you are on a good page with them. Even when they send the papers, the assessment paper to the documentation or the paper documentation to your doctors, when they see it, they know that you know what you're doing. Not to use and come and write all the long story, the patient leg, the pain, okay, the broke leg and all that. There are medical abbreviations for all these things when someone breaks leg. There are medical, for example, now you're asking, you want to talk about this acute renal failure. You can just do a remark, oh, this patient is having AFR in a capital letter. When the doctor sees this, when the RM nurse sees this, they know that this patient is having an acute renal issues, like kidney failure and stuff like that, okay? Then when we want to talk about blood, visible blood stuff on patient and all that, culture, when you want to talk about culture, you can just write, okay, C and S. When one is going through it, your superior is going through it, they're talking about culture and sensitivities. Do you get it? So you want to talk about capsule, you can write a CAP. And maybe you're writing CAP on capsule should be in a small letter C and small letter A and P. Because if you're writing capital letter, that simply means something else. Do you get it? And like when your patient is complaining of one or two things and all that, you can decide to say O in capital letter C/O. When someone sees it, when your superior sees it, they know. So medical abbreviation goes a long way in healthcare sector. So now, when we talk about that, when we put all those things in, there is something they call ethnical principles. That means we are talking about cultures now. When we talk about ethnical principles, we're talking about cultures. Every individual has their cultures, where they are coming from and where they're. Cultures also mean your mood, the way, not being afraid when you're working with a superior now, not being afraid. If you're well cultured and trained, you should be able to say no when you want to say no. And when you're saying the no, don't say it in a rude manner because you're dealing with your superior. The areas where you can say no now, professionally abroad, all this, what did they call it? For example, now in Nigeria, you find nurses, what do they call auxiliary nurses? The senior doctors or nurses use them. They use them to sell children. They use them to collect parts of people's body parts. There are some people, you go to some certain hospitals in Nigeria here, what they do is to do operation for people and sell human parts. And you see them as a normal setting of hospitals. They are doing so many shady business. But if you are a professional, you're not going to buy to that. In that area, you tell them that you cannot, you bluntly say no. You tell them nobody will fight you. Because if you do that abroad, cameras everywhere, definitely they are going to find out. Whatever thing you're doing against the healthcare sector, they will find out. And the moment they find out, your license will be taken off from you. And when your license takes off from you, you know what it is now. You start from a scratch. Do you understand? So when we also talk about these ethnical principles, we're also talking about individuals' cultures. You will meet with Muslims. Do you understand? You're going to meet with Muslims. You're going to meet with different cultures. When I mean different cultures of people from different places, you meet with them. But you do not have to force your culture to them. You have to maintain that their culture. At that moment, they are with you. You don't tell them you're a Christian. Because you're a Christian, you want to read Bible first. You want to read Bible first before you start treating them. It is not compulsory. Before you do that, you have to ask for their consent. And if they say no, you don't force it because that place no be church. If you want to preach Bible, you go on Sunday, go church, go preach Bible. So you must work professionally. Don't say, oh, these people now, they don't believe me. Your God knows whom he believes and knows who worships him into. Every sector has their calling. It's just like coming to the church on Sunday and you're telling people to come and take injections, to come and check them when the time for services is going on. Is it acceptable? They will see you as if you're going mad, right? So the same thing applicable in the healthcare sector. It's not saying that you shouldn't pray for people, but before you do the prayer for people, you should ask for their consent. Because you might want to pray for someone who is an Oboni member. You might want to pray for someone who is worshiping Al-Krishna. You might want to pray for someone who is a Muslim and is against their culture. Then the person might report you to the facility, which might likely take your job. Then another type of ethnical principles where we're talking about cultures, for one to be cultural and all that. Do not collect bribe. When tips are being given to you as a professional healthcare worker, you're not supposed to take it. Every facility has their protocols. There are for some facility, once they give you any money, return it to the front desk. Because some of the patients you're dealing with are patients with dementia. The patient might give you something and after 1 hour or 2 hours, he's telling them that his couple of dollars is missing in his pocket. This is a dementia patient. And probably you did not remit the money, the front desk, you've gone home with it. And they check the camera and see that you are the one who made away with the money. Even when they see the person handling the money, this is a dementia patient. What they tag you to be a thief that you have stolen. So you must abide with these cultures. You must abide with these rules and regulations. Are we on the same page? Are we guys all here?
Yes.
Yes, are we all communicating? So these are the things we should avoid when it comes to the ethnical principles that has to do with cultures. The people get very carried away when people are giving them gifts, especially the local nurses. Please stay away from it. You put it into trouble. It will take license from you. It will return you back home. If you are well being paid, you don't need that. You work harder to get more money being paid and all that. All those temptations, you have to avoid it. There's also what they call legal terms. Legal terms. When we talk about legal terms, there are things you have to avoid as healthcare worker. If not, you go to jail. Avoiding these things, you go to jail. If you don't go to, because legal terms, avoiding legal terms, they have law. Just that time is not on our side. Would have gone too deep inside. But when you're talking about avoiding legal terms, those legal actions, avoid them. Because if you keep personal, you must keep personal information confidential. Every patient that is in your care, keep the information confidential. So a patient might confide in you. For example, now a patient that has a swollen eye and the patient confided in you that, oh, I'm being battered by my husband. And suddenly you find the husband coming to the facility. You are the nurse in charge, the assistant nurse or any healthcare worker in charge that day. And when you saw the man, the moment he did, he just this useless man. Who sent you? He just told the man that the wife informed you that she's been battered by him. So the man, they have the right to sue you. The senior healthcare workers don't do this. Healthcare workers don't do it. Professional healthcare workers don't do it. You keep these things confidential. If your patient is HIV carrier, if your patient is a cancerous patient, you do not need to come and start going behind this thing. Everybody in your street, you say, that patient now, where they live for road, so. Say that man, a cancer patient, he come our facility today. It's wrong. If the man finds out, the person can sue you. You can go to jail for it. So you must keep your mouth shut. When you as a professional, you must learn how to avoid all these legal terms. Then secondly, only perform works that are assigned to you. No go do this thing, ITK, make them should say you get muscle. Now you walk past. The tasks that are being given to you at that moment, at that time, at that period when you're on duty, except otherwise from your superior, only perform those tasks. Don't go and exceed above the tasks given to you. Okay? And also do not do less work. Do not do less work. That they give. Do not do less work than you are being given. Okay? Avoid doing careless work or low quality job. It is important. Avoid doing careless work or low quality job. If you do careless work or low quality job, they will fire you. Don't be careless. Hello? 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 Hello?
Hello. Hello.
Okay.
We are here.
Yeah,
Hello.
Continue, ma'am.
Hello.
okay, are we there?
Just continue, ma'am.
Hello. We can hear you.
Yeah, when you do
We can
low
hear
quality
you.
job,
Can hear you.
if you do a low quality job, they will fire you. That means you didn't go to school. Quackeries are not to be accepted. Assumptions are not to be accepted when you're working as a professional. So you begin to put that into practice if you want to work outside the country. You want to work abroad, you must wake up on time. You must do all your tasks on time. Do not do half big job. Do not do half big job. It's not acceptable. And don't talk to your patient anyhow. Just like in Nigerian, you see a pregnant woman who is in labor, and Nigerian nurse will tell you, say, "Madam, come here, come stay. No be me give you belle." You might just dump and push us anyhow you like. You don't do that abroad. When you do that, you go to jail. You go to jail. You do such activities outside the country, you go to jail. If they tell you to do a vital sign assessment and you're going to do something else, you're going to go and start dressing bed, and it's not written on your tax, you answer query for that. Except there is an otherwise, you must take instruction. Whatever instruction that is being given to you, that is what you should carry out. Do not do above that or below that. Okay. So let us talk about the settings we have in healthcare, the areas that you have to work in most of the facility you work abroad. The key terms of this area, the working patterns, the working areas.
Hello, Wale.
Hello.
Moi, Odeon.
All the working care system in healthcare system. Let's talk about it today. And we're going to talk about acute care setting. The acute care setting. Talk about the patient. We talk about inpatient care. We talk about the outpatient care. We talk about the subacute care setting. I might not mention all, I might just mention few so that we'll be able to also explain it for people to understand it, not just mentioning it. So we'll also talk about the Medicare, we'll talk about the residents, we'll talk about the nursing home, the long-time care. If I mention up to 10, let us know the long-time care setting. Then we'll also talk about the Occupational Safety and Health Administration, which is the OSHA. I think she's up to 10 now. She's up to 10. The omnibus budget. So we'll talk about that. When we're going to talk about the acute setting, what is the acute setting? When you have acute setting, a lot of us will be hearing of acute setting. So we'll talk about acute setting. These areas are specialized, providing care for people who become sick or injured suddenly. Those are who have conditions like delivering a baby, that require short-time health care. So when they're talking about acute, this care provide acute care setting until the person is medically stable. You understand the length of stay in an acute care setting is short. So when they say acute care setting, so you will not be thinking, oh, at least when a woman put to bed a normal delivery, had worst case scenario, you don't stay more than a day or 2 days, right? Hello.
We can hear you.
Yeah. So
Hello, I can hear you.
Yeah, when we talk about patients are those people who receive treatment in the hospital or acute care setting. These are patients. So when we talk about the inpatient, those patients are those people who stays like overnight in the hospital, inpatient care. But not all hospitals that keeps inpatient overnight anyways. Some patient might come to receive care, therapy, like chemotherapy for cancer patients and all that, surgery and repairs. maybe broken bones and go home that same day, but they might stay longer. You understand that thing? Then outpatient too. Maybe they come for a while. Those outpatients, they come for a while, like the ACISA, such as clinical health facilities devoted, such treatment of diagnosing tests and, for outpatient or surgical centers or healthcare facilities, perform healthcare surgeries and, the person is admitted for surgeries and sent home that same day. Those ones are called the outpatients. So all these settings, these settings, we're talking about all these are the settings you find. Then maybe let's wrap up that one. We can talk about the health, the healthcare settings and all that. So maybe all those other settings you learn about it during the period when you come for your training and all that. When you're doing for your training, learn about those people. So when we talk about the people in this clinical service provided within the hospitals, all these Medicare, surgical people, cardio, for example, cardio are those people who cater for heart issues. When we talk of the advanced heart cardiovascular stuff, they are the people they call cardio, So for example, so intensive care, people are very, very unstable, medically unstable, who have to live, they're threatening of life or illness or conditions. Those people, they keep them in intensive care. So let's not waste more time in this area. So, but if you want to stay, if you want to work abroad, you want to stay abroad and work for too long, there are principles. Some people that want to travel abroad, they say there's money in healthcare section. If you're traveling abroad because of the money, you might not be able to make it. You must have passion for it. You must have the proper certificates for it. Because if you don't have passion for it, you don't have the proper certificates for it, you might not likely do well. Abroad is not a place where you do eye service. Abroad is a place where you're going to deal with professionals, people who are in this system for a very long time. When you smile, they know the step you take, they know. So you must prepare yourself. And always remember that we Nigerians, we have red flag abroad. So any setting you go as a Nigerian, they see that your passport, Niger Peking, their eyes there on you. Even if you won't work yourself, their eyes on you. They believe that one day you want to cheat, you want to do one shady business or one thing or the other. So you must work on a very standard professional level. You must work on that level. If you don't work on that level, you're going to fail. And if you're traveling abroad, don't say, okay, because once you prepare all your documentation, all your paper, get the right document and order, also have some cash with you. Have some cash with you. At least that you'll be able to pay for your rent for 3 months. You'll be able to pay for your rent for 3 months while seeking for a job. That is because two things are involved.
Hello, ma'am.
Either, hello there. Hello. Hello, Mr. K. Hello. Hello.
Hello.
Yes, I can hear you. Hello, you're not hearing me well.
Hello, we can hear you, ma'am. Continue, ma'am. We can hear you, ma'am.
Okay. So, like I said, two things are involved when you're traveling abroad to work. One, either they are getting a job for you directly from a company. You apply a job. But always remember, when you apply a job directly to this company, you must sign a contract, a job contract with them. And when you sign this job contract with them, the job contract might be from 1 year to 2 years, or from 2 years to 5 years, or from 5 years to 10 years, depending on the facility, on the contract you agree with them. So therefore, when you sign this contract and they issue you this job and they send it to the embassy with the documentation and everything, you get this job, you go directly and you work with them. Always remember, you're not going to breach this contracts. So that is to say that even if you find other Nigerians who are working in other facilities and they are making 3 times of what you're making, You cannot violate that law. You cannot breach the contract. You're going to be there with them for that 5 years until the contract is over before you can sign out and look for a job somewhere else. Then the other hand, if you prepare yourself, get all your documentation, get your visa, then travel, always remember that you must have an extra cash. Abroad is not like Nigeria. If you go abroad, you don't pay for your utility bills, your light will be cut off, your water will be cut off. There is no story to tell your landlord, please, tomorrow they will chase you out of the house. You'll be kicked out of the house. So you must prepare yourself at least to hold at least 3 months money to pay for your rent for 3 months and feed yourself, take care of yourself while you are seeking for the job. Do you understand? Why you're seeking for job? Okay. So you have to prepare yourself, but you have to prepare all your documentation. All your documentation should be legit. Do not go backyard and buy documentation, because every setting, every healthcare setting, RMs has their topic, their curriculum. Caregivers have their curriculum. Nursing assistants, they have their curriculum. Doctors have their curriculum. Every health assistant has their curriculum. Medical assistant has their curriculum. So when you're going for the interviews, they're going to ask you according to what they find out on your CV. And if you're lying to them, they know. And also remember, there is a machine that dictates lie. So when you're lying, they're saying this the machine will dictate liar. Don't be smart. It is better you're plain and sincere. When you're plain and sincere, sincerity can take you there and give you what you're looking for. Okay? So if there is another thing, then let us know. Sake, any more question in this area? Hello? Hello?
Hello,
Does
yes,
anyone have
good
a question?
Yeah.
Hello. Okay.
Hello,
Guys,
ma.
We can hear you, ma.
Okay.
Okay. Sorry, he was having network problem issues,
Yeah,
but
it's
he's
the
back now.
same network. They just took our light now.
Uh-oh.
Same network
All
issue.
right,
It's
Mr.
fine.
Akorede, are you available now?
Okay.
Safaraj, are you
Yes, I'm
stable?
back online
Okay.
now.
Yeah.
Yeah.
Is there no more questions that we're going to tackle? So we can answer questions. Please, we've exceeded like 30 minutes now. There are questions to answer.
All right. So the floor is open. If you know you have a question, you can raise your hand so that we can definitely pick you out for the remaining time that we have left. Though we created an opportunity for people to post questions in the group, but probably that was a little late. We didn't really get too many questions, but now's an opportunity to still ask. If you have any question, please kindly raise your hand so that we can identify you. And then if not, then we can round up this particular segment of the training.
And before I forget, while we're waiting for the question, always remember abuse. Abuse. One Nigerian guy now, we carry for mind, say, let me get this healthcare certificate. Make I go find a wife or I won't marry. So now the hospital be the section where you go get. Carry for mind that abuse is a criminal offense. It will land you to jail. You should allow the woman to be the one to throw the passes or the man. Don't say, oh, one handsome man, I look for you, I won't marry. I don't come, this nurse what I come do for abroad. I don't capture husband. So when they ask you to go and perform tax, you're indirectly romancing the man. Camera will pick it. The man might sue you. The man might be no nonsense person. The man must sue you and you go to jail and your license will be taken from you. At the same time, when you're also being abused, you also have the right to sue the person. That is why I always advise people to go to all these refined countries that keep to their laws. Most people say they want to go to Arab. Arab will not send you any message what to do. So So if
Okay,
there are
ma.
questions, we are waiting for the questions.
Okay, I can see Mr. Benson is raising his hand. Hello.
Hello, good evening, sir, and everybody.
Good evening. You're highly welcome. Please
Yeah.
state your question.
The desire to work in Canada, my wife has that desire. My wife is a nurse and midwife, and she's interested in taking this training that can facilitate her going to Canada to work. How do we make it easy for her? Because we are actually in Warri here.
Okay. For her to go and work in Canada, what is your wife's qualification in healthcare sector?
She's a nurse and midwife.
Okay, she's
And
a nurse and a midwife.
And she had a BSc in health education.
Okay. Does she have any international certification?
Not yet.
Not yet. Okay. So we'll have to prepare her for one or two. We'll have to prepare her for one or two to attach to her CV. It's easier for her to quickly go and pick up. She's not in the group of people who start with 3 million or 4 million salary. She's in the group of who start at least from 8 million and above. But she needs to have at least some certification. Mr. K, take a note. Madam Dorcas, take a note of this particular person.
Okay.
So they have to make provision of this thing, at least ACLS for her, and this thing, what do they call it? Health and safety, yes, for her. International certificate for her to attach for her with the qualification she has already. It's okay. So then with the people that we're dealing with, the Canadians, the people we're dealing with, so we'll have to also discuss with them, because when she gets to Canada, they will ask for that Canada certification. So they will ask her if she has any Canada certification. So we have to discuss with them, our students who need that Canada certification, how much it is. Please put that one in, so we can discuss with the man. Okay. So we'll get back to them. So what it will take for her to get those qualifications attached to her, the ones she has already, for her to start processing for Canada for a job.
Hello?
Okay, so Benson, I hope you got that.
I got that, but I just want to ask another thing. Is there any age limitation? Because my wife is 63 now. She's going to 64 this year.
For Canada, I don't know. For Canada, I don't know. But for other countries that I know, at least from age. Did you say 63?
She's 63 in November.
Okay. For Canada, I do not know, but I'm going to verify. Then we'll get back to you. But what I know, from age 18 to age 60 is welcome in healthcare sector. As long as you're strong and able-bodied to work, you're healthy.
Yeah, and it also depends on what age people go into listen, people retire in the country.
Exactly.
Like the pension age, so you have to also consider that it's different with different countries too. So
exactly.
yeah.
So we'll find out, we'll do the research. Dr. Choma, Mr. K, Madam Dorcas, and Oganero will do that research to find out in Canada if that age is suitable for your wife. But if the age is not suitable, while we're building the healthcare sector here, we're also looking forward to paying people more than what the federal government pays in our areas. So we'll see what we can do for her to do something too. So we'll get back to you, sir, Mr. Ben.
Okay. Thank you.
All right. Thank you, Mr. Benson. We have Idris Fatima. Okay, no, sorry. We have Deborah Gaspar.
Okay.
Deborah, are you with us?
Hello. Hello, everyone. Hello, Ma.
Good evening,
Good evening,
Debbie.
ma'am.
Good
Thank
evening.
you very much. Thank you very much for the lecture. Thank you. We really appreciate all the information that you've given us. Ma, please, my question is, can someone, my sister that is a business administrator for like 18 years, that wants to convert into a healthcare provider? She has already gotten some international qualification, like she has a caregiver, she did caregiver awareness, she has a basic life support, advanced what's it called, cardiac life
Cardiovascular,
support.
ACLS, yes.
Yeah, things like that. She had so many of other certificates that are welcome in abroad. But the problem is that she only worked in an hospital for like, she did a training there for 3 months. For 3 months, she had the certificate auto, but the foundation is business administrator. Can she go into healthcare?
Yeah, she's welcome. She's welcome. All we need to do is to train her on the practical aspect of it, so that she will now know the practical aspect of healthcare sector on how to handle patients and all that. Then she's good to go to pursue her career in healthcare section.
Okay, but she's not in Nigeria. How can she be trained on practical? She's not in Nigeria. She's already traveled, but she traveled on visitor visa that wants to convert. So she's about to submit application, but I'm thinking this kind of program is good for her. That's why I registered for the program to explain to her.
The qualifications she has, apart from the business administrator system where she was in the healthcare section, she never did anything. Is it online qualifications?
Yeah, they are online qualifications.
I just pray because we accept this online training. I and my team member, we've decided that we will be doing the online training for our students. But you see,
Okay.
we try to be transparent here, because the project we have now is a long time project. We don't want a project where they go to Ministry of Health, dictate our tariff, or National Health Insurance, dictate our tariff, then they find us here and they think maybe we're doing something quackery with our team members and all that. So we try to be transparent. In most outside the country, the truth of the matter is that they want to see you where you are practicing.
Okay.
In environment, in a facility where you're practicing. So since she's not here, I would like to advise her, let her find a facility where she can practice.
Okay.
I don't know the country.
Maybe like, she's in Canada. Maybe she should study. She should go and study like a diploma course or something.
Thank you.
Okay.
There is no time to waste. Let her go and study a diploma course somewhere. And when she studies with those papers she has, they will give her a job. But the pay may not be too much, at least 1.something million, 2 million naira she might be earning. But then they will find her in the system. Maybe after 1 year, 8 months or 2 years, she is good to go. But they will be paying her something that will sustain her to build her career. Let her not go and start diverting. Healthcare sector is one of the best she can do outside the country. Let her quickly now go to a facility, send her documentation to the facility, tell them she wants to study, because most of this facility has universities they work with. Tell them she wants to study, at the same time work with them. They will give her a job and assist her with studies.
Okay. All right. Thank you very much, ma'am.
You're welcome, madam.
All right. Thank you, Deborah. Next we have Idris Fatima.
Good evening, everyone.
Good evening.
Good evening.
I say a very big thank you to the facilitators of this program. It's a very good opportunity for us. My question is, I'm a community health worker.
Okay.
So I want to know more. I want to ask for that. How do I fit in for qualifications outside Nigeria? That's number one. Number two is, as your team now, I want to know if you do handle physical classes, practicals, and your location. Because as you're giving us lectures, and the thing is really sinking in me, and I know others too really enjoyed it. So I wonder how your physical class is going to be. I don't know if you're getting me. So if there is a physical
Yeah,
class,
we do.
I I know
We
people
do
will
have a physical
always
class.
want
We
to.
do. We
So I
do.
want to I want to have the location, your as in just make
Madam
inquiries
Deborah and Mr. Korode will give you the location.
and while
You get the
trying
location.
to
You
not
get the
yet.
location. We get the location, the details, the time we study, and all that.
Okay, I'm in Lagos.
Yeah.
In
Say
Lagos.
what?
So I want
Okay.
I'm in Lagos. In Lagos.
If you're in Lagos, we have accommodation for people who are coming from afar. You just pay for your accommodation and all that for the period you're going to study.
You guys are not in Lagos.
We're not
No.
in Lagos. We're in Abuja at the moment. Looking forward to having something in Lagos.
Okay, so if I want to now take a step further, going international, what are the things I'm going to
You'll be in
need
Abuja
as a
with us to be in the
community?
physical class.
I mean, if I want to take a step forward in traveling abroad with my course, what are the things I'm going to need? You know, it's not a nursing or
With the course
or
you have,
midwifery.
being a healthcare public health person is not just enough for you. You have to get other requirements too. You know, the more requirements you have, the more documentation you have, is a better edge for you. That is the more your salary increases and the more chances of you getting a better job in the healthcare sector.
Okay. Can I have further contact so there will be a follow-up? Is there someone I can talk to, as in maybe
Yeah,
after the.
Of course, you should speak with Mr. Korode or Madam Dorcas.
Okay. Thank
All
you
right.
very much.
Okay, thank you, Idris, Fatima. We have just about 4 minutes left. Mr. John Monica. I think that's a
Yes,
lady.
sir.
Okay, yes. So please, can you
Okay, good
give your
evening,
question?
sir.
Good evening.
Good evening, ma. Thank you for the lectures. I really enjoy it.
Thank you. God bless you.
Yesterday I still asked questions towards the ending like this. The question I was really wanted to ask, I think someone has asked, but I'm sorry, I want to say something about this Mrs. Is it Idris Fatima or something? She said she's a community health practitioner worker. That's it true. Even me, I told yesterday, I said the same thing. It's the same question I asked yesterday, but you advised us that we should come to the Abuja training center, that we need this certificate, this nursing assistant. Then if there's any way that we can travel out, then we have to go and like study something like that, because I was confused with the same thing. I was added like, okay, I have a BSc in public health too attached to that. And my question that I wanted to ask is about the traveling issue. That yesterday you said there's somebody that he's going to explain, like a traveling agent that will shed more light on us today. So that was my question that I raised hand for it, but it's like somebody has already asked similar questions to that about his wife. How should she travel? Yeah, that was my question that I wanted to ask.
It's fine.
Mm.
Are there more
Hello?
questions? Hello.
Okay. Did you get that
No,
now?
yes, I don't have problem. Since me, I'm in Abuja. If I get the address in 2-3
Uh-huh.
days, any day I can
Okay.
move and go to the office, I think.
Oh, okay. That's fine. That's fine.
Mm.
Sorry.
Please, I have another question, please. I'm sorry. What's the duration of the program? So one
3
would know how
months.
to.
3 months. 3 months.
3
Then
months.
maybe one.
Is it a back-to-back program, or there's going to be a break
3
in
times a week.
between?
3 times a week. 3 times a week.
3 times a week. So it's going to be a
Yeah,
stretch
then
of.
extra 1 month for your internship. So between 3 to 4 months.
Okay.
But you can still do your
And
internship somewhere else if you want to.
even in Lagos.
Even in Lagos, you can. What they give you reference to?
Okay, thank you.
You're welcome.
All right. So once again, thank you so very much, Matt, for your time. You're highly appreciated. I know you're a very busy person, and I do not, take for granted the time that you've been able to, give to us. So thank you so very much. For definitely, each and every person here is connected with different training providers, and we'll definitely be able to channel them all questions even after this. For anyone that we cannot answer ourselves, we'll definitely put them forward to you. So once again, thank you so very much, Ma. You're
You're
highly
welcome. God bless you. God bless you.
appreciated.
Thank you very much. I do appreciate. I'm
Yes,
glad
ma'am.
to be here to
All right,
contribute to
ma'am.
people, not to make mistake out there and all that. They shouldn't
Exactly.
travel in the name that maybe when they get there, they want to
Yes.
come and start calling one healthcare sector to buy them certificate and all that. Take the time now. Make sure you study. Knowledge is life. Knowledge is powerful. If what you have, you utilize it, it brings money on your table. You can see the way Nigerian is going on now. A lot of ritualists out there, people selling their hand for money one way or other. God has given us something that can bring food on the table for us. Just take a time out. Spend 2 months, 3 months, 4 months is not too difficult for you to get something that will give you a foundation for you to balance your life and get something meaningful out of it. Do not travel outside the country without having any qualification. Do not travel outside the country without planning for it. You might go there and find yourself doing what you are not supposed to do. Life is not easy out there. But when you have a means of livelihood, you take a life the day one step after the other. It pays better, and there is respect for you, and you maintain your dignity. Thank you.
All right. Thank you so very much, ma'am. Thank you so very much.
Thank you
All
so
right,
much.
Thank you.
everyone. All right.
Yeah,
So
God bless
thank you
you.
so very much, everyone.
Very much, ma'am. Thank you, ma.
Thank you.
Thank you, sir.
Thank you. God bless you all.
Thank
Good night.
you.
Thank you, ma.
Thank you, Dr. Choma. God bless you.
Thank you. Good night.
All right.
Thank you.
Okay, so for everyone, we were supposed to start the second segment, but unfortunately, the agent that was meant to speak with us had a family emergency, and he's not able to join us at this point in time because he actually joined, and I saw when he came in, but then he had to leave, and he sent a message saying that there was an emergency that he had to quickly take care of. All right, so we apologize for his absence. It's something that's beyond his control at this particular point in time. However, having said that, we have, because he's somebody who has done a lot of trainings with us in the past, especially when it concerns traveling and visa runs and services and opportunities and all whatnot. So in the meantime, while we see if there will be a possibility of having him back again, we'll see if that is possible, and if it is, we'll definitely let you know. But in the meantime, some of those recorded sessions, we'll definitely share them with you. And I urge you to take your time to listen to those recorded sessions. It details out all the do's and don'ts when it comes to traveling. It tells you what sort of countries you should go, and those countries, every country has its own requirements. So it's important that you know what those requirements are, and you're able to have your documentation properly put in place so that you don't run into trouble when you travel out of the country, or when you're even trying to travel out of the country. We've heard of cases of people, like I know of one recently who had some documentation, and because his flight was passing through the US, he was stopped at the US airport, and he was sent back because he had some documentation, or there was something which he had which was not allowed to pass through. So these are some of the things that you need to know about so that you don't run into trouble as well. So once again, we really apologize for his absence. And having said that, hopefully through the videos, a lot of questions that you may have would be answered. But even after watching those videos, if you still have questions, please do not hesitate to get across to any of the training providers through which you are coming through. All right. So once again, thank you so very much. Your presence is highly appreciated. I want to believe that you've gained value for this course. As I said, the reason why we decided to have this is because over time, we realized that a lot of people are making the decisions without being informed. They don't really know what is going on, and they don't really know the right step to actually take. So I do hope that some of your questions at least have been answered. So thank you once again, everyone. At this time, we'll definitely be closing this meeting.
To come back up to confirm their trip.
All right. So thank you very much. We'll reconvene, or at least messages will be dropped in the WhatsApp group. So do have a good night, everyone. Thank you.
Right. Thank you.
Thank
Good
you.
night.
Thank you.
Good night.
Thank you so much. Good night.
All right. Night.